Good afternoon. I'm Dr. Peter McCullough, and I'm an internist and cardiologist and professor of medicine at Texas A&M University School of Medicine. I'm on the Baylor Dallas campus, and I've been integrally involved in the response to COVID-19. The opinions I'll express are those of my own and not necessarily those of my institution. I can tell you that in my field, I'm an academic doctor. I see patients, but I'm very involved in research. I'm an editor of 2 major journals. In my field, I'm the most published person in my field, which deals with the heart and the kidneys in the world in history. There's 2 bad outcomes to COVID-19, hospitalization and death. The second premise, if we don't do something before the hospitalization, we can never stop it. We can never stop it. And I have to tell you, and I was the lead author in that paper, but we had dozens of authors from Italy, India, UCLA, Emory. We had the best institutions in the United States. I can tell you the interesting thing was there was 50,000 papers in the peer-reviewed literature on COVID. Not a single one told a doctor how to treat it. Not a single one. When does that happen? I was absolutely stunned. I had never been on social media before. My daughter, who was home from law school, was talking to her about it. She said, well, why don't you make a YouTube video? So I made a YouTube video with 4 slides from the paper. This is a peer-reviewed paper published in one of the best medical journals in the world. 4 slides. I even wore a tie and a suit, and she showed me how to record it in PowerPoint, and I posted it on YouTube. It went absolutely viral. And within about a week, YouTube said, you violated the terms of the community. And that's when Senator Johnson's office got involved in Washington and said, oh my gosh, this is important scientific information to help patients in the middle of this crisis, and social media is striking it down. Based on what authority? Well, one thing led to another, and I became the lead witness for the U.S. Senate testimony of November 19th, 2020. And the reason why there was Senate testimony is because there was a near total block on any information of treatment to patients. A near total block. And so what had happened over time is that we had gotten into a cycle in America of no information on treatment. Patients actually think that the virus is untreatable. And so what happens is they go out to get a diagnosis. Now, I'm a COVID survivor. My wife in the galley is a COVID survivor. My father in a nursing home is a COVID survivor. You get handed a diagnostic test. It says, here, you're COVID positive. Go home. Is there any treatment? No. Is there any resources I can call? No. Any referral lines, hotlines? No. Any research hotlines? No. That's the standard of care in the United States. And if we go to any one of our testing centers today in Texas, I bet that's the standard of care. I bet that's the standard of care. No wonder we have had 45,000 deaths in Texas. The average person in Texas thinks there's no treatment. They honestly think there's no treatment. So I led the initiative. The second paper was published in a dedicated issue of Reviews in Cardiovascular Medicine. Now I had 57 authors, including Dr. Urso, Dr. Emmanuel, lead doctors in Houston, San Antonio, all over. And it was another worldwide paper, and now we have it updated, integrated. So yes, we use drugs to affect viral replication. The antibodies are terrific. We can use intracellular anti-infectives in that box. We use corticosteroids and inflammatory drugs. The best anti-inflammatory drug is colchicine. You've probably never heard about it. In the largest, highest quality randomized trial, over 4,000 patients, double-blind randomized placebo-controlled trial, there's a 50% reduction in mortality. No word of it. None. Complete block to anybody, colchicine. How can that be? How can that be? And then the most deadly part of the viral infection is thrombosis. So I have always treated my patients with something to treat the virus, something to treat the inflammation, and something to treat thrombosis, just as Dr. Urso had. But I have to tell you, what has gone on has been beyond belief. How many of you have turned on a local news station or a national cable news station and ever gotten an update on treatment at home? How many of you have ever gotten a single word about what to do when you get handed the diagnosis of COVID-19? No wonder. That is a complete and total failure at every level. Okay, let's take the White House. How come we didn't have a panel of doctors assigned to put all their efforts and stop these hospitalizations? Why don't we have doctors who actually treated patients get together in a group and every week give us an update? Why didn't we have that? Why didn't we have that at the state level? Zero. Why don't we have any reports about how many patients were treated and spared hospitalizations? I listened to 6 hours of testimony today. Zero. Zero. We have a complete and total blank spot on treatment. It is a blanking phenomenon. So what can be done right here, right now? There's going to be more people that die in Texas, and it's an absolute tragedy. How about tomorrow? Let's have a law that says there's not a single result given out without a treatment guide and without a hotline of how to get into research. Let's put a staffer on this and find out all the research available in Texas, and let's not have a single person go home with a test result with their fatal diagnosis, sitting at home, going into 2 weeks of despair before they succumb to hospitalization and death. It is unimaginable in America that we can have such a complete and total blind spot. I blame the doctors for not stepping up. Where was the medical society stepping up and putting effort on this? How about from the federal and state agencies? There never was a single bit of group collaborative effort to stop the hospitalizations. Nobody even kind of thought about it. Bob Hall had me on a teleconference in April or May, and we're like, wait a minute, how come, where's UT Southwestern? I'm a graduate of UT Southwestern. Where's A&M? Where's the rest of the universities? How come we're not stopping this? How come we are not stopping this? I had a terrific doctor from Brazil. We went through country by country by country and just asked the question, what are other countries doing? When was the last time you turned on the news and ever got a window to the outside world? When did you ever get an update about how the rest of the world is handling COVID? Never. What's happened in this pandemic is the world is closed in on us. There's only one doctor whose face is on TV now. One. Not a panel. Doctors, we always work in groups. We always have different opinions. There's not a single media doctor on TV who's ever treated a COVID patient. Not a single one. There's not a single person in the White House task force has ever treated a patient. Why don't we do something bold? Why don't we put together a panel of doctors that have actually treated outpatients with COVID-19 and get them together for a meeting? And why don't we exchange ideas? And why don't we say how we can finish the pandemic strongly? Isn't it amazing? Think about this. Think about the complete and total blind spot. So what happened, I can tell you what happened. What happened in around May, it became known that the virus was going to be amenable to a vaccine. All efforts on treatment were dropped. The National Institutes of Health actually had a multi-drug program. They dropped it after 20 patients, said we can't find the patients. The most disingenuous announcement of all time. And then Warp Speed went full tilt for vaccine development. And there was a silencing of any information on treatment. Any. Silencing. Scrubbed from Twitter, YouTube. Can't get papers published on this. We can't even get information out in our own medical literature on this. There's been a complete scrubbing. So this program has been one of try to reduce the spread of the virus and wait for a vaccine. And when we vaccinate, all efforts have to be on vaccination. And probably I had 4 hours of vaccination on here. Think about it as we sit here today, the calculations in Texas on herd immunity. The calculations are we're at 80% herd immunity right now with no vaccine effect, 80%. And more people are developing COVID today. They're going to become immune. People who develop COVID have complete and durable immunity. And a very important principle, complete and durable. You can't beat natural immunity. You can't vaccinate on top of it and make it better. There's no scientific, clinical, or safety rationale for ever vaccinating a COVID recovered patient. There's no rationale for ever testing a COVID recovered patient. My wife and I are COVID recovered. Why do we go through the testing outside? There's absolutely no rationale. I'd encourage this committee to actually look at what's being done and ask, is there any rationale? Is there any rationale for anything? Listen, there's plenty of COVID recovered patients. Let them forego the vaccine and let people who are clamoring for it get it. But at 80% herd immunity, in the vaccine trials, fewer than 1% in the vaccine and the placebo actually get COVID, fewer than 1%. The vaccine's going to have a 1% public health impact. That's what the data says. It's not going to save us. We're already 80% herd immune. If we're strategically targeted, we can actually close out the pandemic very well with the vaccine, but strategically targeted. People under 50 who fundamentally have no health risks, there's no scientific rationale for them to ever become vaccinated. There's no scientific rationale. One of the mistakes I heard today as a rationale for vaccination is asymptomatic spread, and I want you to be very clear about this. My opinion is there is a low degree, if any, of asymptomatic spread. Sick person gives it to sick person. The Chinese have published a study, British Medical Journal, 11 million people. They try to find asymptomatic spread. You can't find it. And that's been, one of important pieces of misinformation. When Senator Hall called a conference call of what should we do in the Capitol when we reopened, I said, you know what? You know what we do at Baylor? You walk in and they zap your temperature. You got a temperature check and go in. Do we test everybody who walks into the Baylor Hospital? No. Are they a lot sicker than everybody in this room? You better believe it. So why would we do something here at the Capitol that has absolutely positively no scientific rationale and then do it in this context? So my testimony as I sit here today is COVID-19 has always been a treatable illness. A very large study from McKinney, Texas, another one from New York City, show that when doctors treat patients early who are over age 50 with medical problems with a sequenced multi-drug approach, with the available drugs, 4 to 6 drugs that are available to them, now the monoclonal antibodies are better, there's an 85% reduction in hospitalizations and death. 85%. 85%. I want you to remember that number, 85%. We have over 500,000 deaths in the United States. The preventable fraction could have been as high as 85% if our pandemic response would have been laser focused on the problem, the sick patient right in front of us. We're focused over here and focused over there and focused on masks and what have you. Laser focused, sick patient, treat them. We lost focus on the most fundamental thing. That's my testimony.
Yeah.
Well, make no bones about it. Hydroxychloroquine really works. It's the most widely used therapeutic to treat COVID-19 in the world, hands down. The chances that it doesn't work are calculated to be 1 in 17 billion. So it's a very useful drug. It's been on the market for 65 years. I've prescribed it for 30 years for systemic lupus, for rheumatoid arthritis. We use it to treat and prevent malaria. So it's a very safe and effective medication. India, in Greece, it's in their guidelines to use it first line. I think historians are going to be very unkind to Australia, Canada, United States, the UK, Western European Union, some South American countries. They're what I call the nihilistic countries, the countries that are offering no home treatment, no advice for patients at all, and creating such a fearful population right now that is just, honestly, the population is so hungry for a vaccine to just move on.
So, Peter, just tell us what you think of those public health officials who have not only banned the use of hydroxychloroquine, they've also criminalised it in one state in Australia, meaning that doctors would go to jail even for prescribing it. How many lives do you think would have been saved if simply hydroxychloroquine had been an available choice for GPs to use if they decided to? How many lives would have been saved, in your opinion?
Well, I had one of the first research investigation of drug applications on hydroxychloroquine in the United States. It was March 26 when I filed it with the US FDA, basically over a weekend. So I've been using hydroxychloroquine as a doctor in research and in prescription now since the onset of the pandemic. It is available in the United States, in some states, but with barriers applied. We never use it alone. Hydroxychloroquine is typically used with about 3 other drugs, and that's what I did, 3 other prescription drugs. So it's not hydroxychloroquine alone, but the package of early home treatment is estimated easily could have saved half the lives that were lost, and probably more than half, up to 80 to 90% of avoidance of the hospitalizations. So the public health impact of early home treatment is gigantic. And let me give you an example. In India, where there's a ton of COVID, but they feature early home treatment, the number of deaths per million population in India is less than 100. In the United States, where we have the best healthcare in the world, apparently right up there with Australia, we're all spaced out. We have wonderful lifestyles in America. Our deaths per million population is 800.
Oh,
so wow. India, despite people on top of each other, is doing much better. And so I've always had the view that, listen, a lot of people are going to get sick. Why not work with medications or even develop new ones in order to get people through the illness and not have this be something that ravages society?
Dr. Peter McCullough, so thank you so much for coming on, Outsiders, after your run to talk to us. If you're right, there are at least 400 Australian lives that could have been saved, probably more, but our chief medical officers believed that they knew better than you know. Fascinating stuff. Thanks so much for coming on, Outsiders, Peter.
Thank you.